Hello everyone, welcome to the incredible journey of baby's first breath, a story of fetal circulation. Today we are going to discuss about the fetal circulation in a format of a story. So let's start it. Deep inside a mom's womb, a teeny baby is growing, safe and sound. But how does this little one get oxygen and nutrients? Well, buckle up because today we are going on an epic adventure, the journey of a single drop of blood throughout the baby's body. And we can differentiate it into 3-4 stages. At first, the oxygen superhighway, umbilical vein to the heart. Our story begins in the placenta. This is our placenta, the baby's lifeline to mom. Here oxygen rich blood flows through the umbilical vein, and here is the catch. The oxygen rich blood here flows through the umbilical vein, not through the umbilical artery, like a red carpet delivery service, straight to the baby. But wait, the liver is busy growing now, so the blood takes a shortcut, the venosus. So from the placenta through the umbilical vein, blood first comes to the liver. But here is the catch: as the liver is busy in growing, the blood takes a shortcut, that is ductus venosus, that is this part, ductus venosus. By this shunt, the blood bypasses the liver and directly goes into the inferior vena cava. Inferior vena cava reaches to the right side of the heart, that is right atrium. So we can call the ductus venosus the body's biggest blood highway. Now from inferior vena cava, blood goes into the right atrium. Here is the right atrium, and this is fetal heart, and here is the right atrium. Now the next chapter starts, the great atrial escape, that is foramen ovale shunt. Actually the foramen ovale is a shunt which is present between the right atrium and the left atrium. Normally blood would go to the lungs, and the way is from the right atrium it comes to the right ventricle, and from there with the help of the pulmonary artery the blood goes to the lung. But in this case, in case of fetal heart, what happens, most of the blood comes to the right atrium to left atrium through a shunt that is called foramen ovale, a teeny door that let most blood skip the lungs and go straight to the left atrium. From left atrium, it's a smooth ride, that is blood comes from the left atrium to the left ventricle and out the aorta, filling the baby's brain and body with fresh oxygen. So this is a part of fetal circulation. But there is another catch. If all the blood doesn't go through the foramen ovale and doesn't go from right atrium to left atrium, what happens? What if some blood doesn't take the foramen ovale exit? No worries. It goes into the right ventricle and then the pulmonary artery. Since the lungs here are not working properly, there's a second shortcut that is called ductus arteriosus, that is present in this part. The ductus arteriosus is present between the pulmonary artery and the aorta, which reroutes the blood straight into the aorta. This way every drop of oxygen is used efficiently, no wasted. And now the fourth chapter starts, the fourth chapter, that is the return trip back to a mom for a refill. After delivering oxygen, The now deoxygenated blood heads back to mom through the umbilical arteries. The umbilical arteries are different from the normal arteries. Umbilical arteries deliver the deoxygenated blood, where the umbilical vein delivers oxygenated blood. And umbilical arteries come to the placenta, and it gets a fresh refill in the placenta, and the cycle starts all over again. Finally, the birth. If there is birth, the big changes occurs. But here's the coolest part: when the baby takes its first breath after birth, these shortcuts close. The shortcuts means the shunts, that is ductus venosus in the liver, that is foramen ovale between the right atrium and the left atrium, and the ductus arteriosus between the pulmonary artery and the aorta. And blood finally flows to the lungs. It's like a flipping a switch from womb mode to world mode. And friends, this is how a baby survives and thrives before taking its very first breath. Nature's genius, isn't it? So if we see the total fetal circulation in a tabular format, this is the following. Like step 1, oxygenated blood from the placenta, and through the umbilical vein, blood is rich in oxygen and nutrients from the mother. From the umbilical vein, it goes to the ductus venosus, bypasses the liver to the inferior vena cava. Now the inferior vena cava reaches to right atrium with the oxygenated blood, and oxygenated blood enters the heart. From the right atrium to left atrium via the foramen ovale, bypasses the lungs due to high right atrial pressure. From the left atrium to the left ventricle to the aorta, blood is pumped into the systemic circulation, and aorta to body tissues. Oxygen and nutrients are delivered to all the body tissues. So the deoxygenated blood returns to umbilical arteries and goes to the placenta. Blood is reoxygenated by the mother. And there is additional pathway I have told earlier, that if all the blood doesn't go through the foramen ovale, it comes from the right atrium to the right ventricle and then goes to the pulmonary artery, and some blood still enters the right ventricle. From the pulmonary artery, it takes a shunt, that is ductus arteriosus, and goes into the aorta. Actually, all the blood have to go to the aorta to go to all the body tissues, and it bypasses the lungs due to high resistance. So there is shunts procedure. The shunts means the where the blood bypasses a bigger way and goes through a small way. There is 3 shunts present in fetal circulation, that is ductus venosus should be taken first, ductus venosus, then the foramen ovale, and then the ductus arteriosus. Ductus venosus helps bypass fetal liver, connects to the umbilical vein to the IVC. Now the foramen ovale shunts highly oxygenated blood from right atrium to the left atrium, and lastly the ductus arteriosus helps bypass fetal lungs, connects the pulmonary artery to the proximal descending aorta. And here is the picture. Ductus venosus is not shown here. Ductus venosus is somehow there. It bypasses the liver, and here is the foramen ovale, and here the ductus arteriosus. So if you enjoyed this teeny tale of fetal circulation, hit like, subscribe, and let us know what other amazing body stories you would like to hear. Thanks a lot for your active cooperation from the biology to medicine. Today we have come to an end. Thank you.